So today we're going to discuss how to solve the Medicare puzzle. My name is John Riley. I'm president of Riley & Associates, and we are an independent health insurance agency specializing in Medicare. After nearly 2 decades of serving the employer health benefits space, we transitioned to Medicare. So we have a good understanding for both employer health benefits as well as COBRA and individual plans. So we're in a good position to be able to help you understand the difference between benefits and costs and being able to compare those benefits and make a good decision. Today, we specialize exclusively in Medicare. We've built a specialized team and automated processes and systems to ensure that our clients get the very best high-level service each and every time. So whether you're an individual who needs help with Medicare or you've got clients or an employee, we can be your trusted partner and agency to help you in that process. So our mission is to make Medicare process simple and serve people with excellence. So I think this is the way most people step into Medicare. Is information overload. It's just a lot of information coming at you very quickly. And I think that there's just so many rules and deadlines. And so there's a lot to know. And the closer you get to 65, the more they bombard you with advertising and marketing and this plan or that plan. So it just adds more confusion to the mix. So today we're going to keep it very high level, very simple. And at the end, if I'll answer any of your questions, you can just put them in the chat below, and I'll be happy to answer those after the webinar, or if you want to set up a one-on-one, we can certainly do that, set up a call for a future date. Okay? So our agenda, like I said, it's going to be really simple. We're going to go over the basics of Medicare. We're going to look at your 2 options, because there's really only 2, and our services. So what is Medicare? Medicare is health insurance provided by the government for those that are age 65 and those with disabilities. And it comes in 2 parts. First, Part A, which is your hospital insurance. That covers inpatient or facility care. Generally does not have a premium. And as long as you paid into the system through payroll deductions for 40 quarters or 10 years, or your spouse has, then you have free Part A hospital insurance. Part B is your medical insurance. That's like everything else. That's like your doctor visits, your outpatient surgery, labs, x-rays, diagnostics, complex radiology, things like that. That's all covered under Part B. And Part B does come with a premium. It starts off at $202.90 in 2026. It goes up a little bit each year, and that is where it starts. So the more money you make, the higher your Part B premium could be. And we'll look at that chart here in just a few minutes. So you're going to fall into one of 2 camps, either camp number 1 or camp number 2. So camp 1 is that you're under 65 and you're getting ready to age in to Medicare. Camp 2 is you decided that to delay Medicare because you're with a large group employer plan, and you might have picked up Part A, but you've delayed Part B definitely, and you're staying on the group plan, and then you're getting ready to retire and go on to Medicare. So you're planning for that. So let's take a look at these, the calendar here. So enrollment periods. So I'm going to address both camps. With camp number 1, those that are aging into Medicare, you have a 7-month window. It's the 3 months prior to your birthday month, the month of your birthday, and 3 months after. We recommend you do a discovery call 3 months prior at a minimum, but that's a good time frame. And then that way we can put together a presentation for you, go over your options, help you with enrolling in original Medicare with the instructions and give you step by step throughout the process. And then that way you can enroll and be all set to go for the first day of your birthday month, because that's when it would become effective. So your Part B and the plan that you select generally is going to be on that first day of your month, birthday month. And for those that have delayed Medicare, you've got a couple of extra steps which we can help you with. One's a 40B form and the other one's a L564. But again, start 3 months out, do a discovery call, understand what your options are, kind of your path, and we can help you with the timeframes and getting enrolled. But you've got 8 months, so you got an extra month for somebody that is coming off of an employer group plan after age 65. And then there's 3 other enrollment periods we'll look at just briefly. One, which is an important one, which is your annual election period. And that begins on October 15th. It runs through December 7th of each year. And that's just a great time to review your options. You know, a lot of times our health can change throughout the years. We get new medications or change doctors, or we have a health condition that needs treating. And so we actually have a campaign that goes out starting in August where you can securely update your medications, change doctors. That way we can review it in our system and then make any recommendations. And so you're way ahead of that curve. So that's a good time then to make changes for the new year. And then your next enrollment period is for those that are already on what's called an Advantage plan, which I'll touch on in just a minute. But that's the first 3 months of the year. You can change between Advantage plans or go back to original Medicare. And I can explain more on that later. But that is the open enrollment period. And then for those that missed their initial enrollment period, you're going to get hit with a penalty, and they're going to make you wait until until the first part of the year. So the first 3 months is called the general enrollment period, and that's when you'll be able to go ahead and enroll, and you'll have a lifelong penalty. It won't be much if you've missed it by a few months, but if you got a few years, it might add up a little bit. Okay, so let's go ahead and move on. So there's 4 parts to Medicare. We've already covered 2 of those, which is Part A and Part B. That's known as original Medicare. And then it's not quite complete, which we'll talk about in a minute. So you might need to get a Part D if you're going to stay with original Medicare. That's your prescription drug coverage. And Part C is your second option. So option 1, which we'll go into, is called original Medicare. You add a supplemental to pay for the out-of-pocket costs, and a Part D plan, which makes you complete. So now you have a comprehensive plan, or you go with what's called an Advantage plan, which is Part C. And that is that covers Part A and Part B. It covers the out-of-pocket costs as well, and includes a prescription drug plan. Okay, so those are your 2 options, which we'll look at more here in depth in just a few minutes. Okay, so Part A and Part B, that's original Medicare, and you've got deductibles and coinsurance that you would have to get covered, and you can stay with that, but it could be expensive if you didn't get either a supplemental or go with an Advantage plan. Okay, there's no out-of-pocket maximum, so if you had a really bad year of being in and out of the hospital, it could be pretty expensive, right? So most people will get original Medicare, and then they will either add a supplemental and a Part D plan, or they'll go with an Advantage plan, and that's your Part C. So Part C is your Advantage plan, and that works just like an HMO. So both of these plans are going to be pretty similar to you in the sense that when the plan that you're on now is probably either a PPO or an HMO. When you come to Medicare, it's going to be the two same options. They're just called something different. You know, they just make it complicated with all these letters and that sort of thing. But basically, this is kind of your PPO option if you like the freedom to go to most any doctor or hospital in the network that you're in right now. This is a good option. It gives the ability to go between states. If you like your HMO, this is going to be a good option. It's going to be a little bit lower out-of-pocket costs in terms of premium. Generally no premium for those in California. Some do have premiums now, but most of them still don't. but you get a lot of extra benefits and that sort of thing. And that includes the Part D. So we're going to jump into both of these. Let's go ahead and take a look at the original Medicare, your out-of-pocket costs. So Part A has an out-of-pocket cost of $1,736, which is your deductible for Part A for your hospital care. So if you're admitted in the hospital, you're going to pay $1,736. Now the difference is it's not an annual, it's a per incident deductible. So if you've gone into the hospital and you've been out for 60 days and then you go back in, they can charge you another deductible, right? So just something to know. And then if you're in the hospital past 61 days, there's a copay of $434. And keep in mind, either a supplemental is going to cover these costs or an Advantage plan is going to cover these costs. So the Medicare Part B, you've got a $283 deductible for Part B, and that is an annual. So if you go with a supplemental plan, this is going to be your only cost on the medical side. You would pay through that at the beginning of the year, going to a doctor or getting a lab. You pay through the $283. It's a one-time deal, and that way you're covered, and all these other things are covered, including the co-insurance. If you get an Advantage plan, then also this would be covered as well as the 20%. So the supplemental, this would be your only cost. With the Advantage plan, it covers all of these things. Okay, all right. So let's take a look at your options. So we're trying to make it real simple. You've got two options. You have original Medicare and you have a Medicare Advantage plan. So original Medicare, again, is Part A and Part B, and then you would add a supplemental to cover those costs that we just talked about, the deductible and co-insurance. And then you would add a Part D plan, which is a prescription drug plan. And if you're on a PPO now, you would really like the supplemental, because when you go with the supplemental and original Medicare, you can go to any doctor, any hospital in the nation that takes Medicare, which is majority of providers. And so it's really just a super plan. And the only cost, like I said, is the $283. So you've got real freedom there. You've got a plan that offers better benefits than what you're on now on the employer side. And it's a great option. The other one is option 2, which is a Medicare Advantage plan. And that is also a super great option. The Medicare Advantage plan here in California, we have one of the best networks in the nation. You can go to UCLA, Cedars, Torrance, Providence, PIH. We've got one of the best networks in the nation. And that includes Part A, Part B, and Part D. And they give you extra benefits too, which we'll get into. But that's a really good option. So if you like your HMO, you like your doctor, network, and hospital, this is a great option for you. So you've got really two great options. It just depends on your needs and what you prefer. Okay. So earlier I mentioned there was a chart for Part B premium. Everyone has to pay a Part B premium. Whoops, sorry about that. Everyone has to pay a Part B premium. And it starts off at $202.90. And I'm going to put my phone on silent. And anyway, it starts at $202.90, but it can go up based on your income. So the more you make, the higher your Part B premium. So we actually have a video and a bunch of material that helps you plan at 62. So preparing for Medicare at age 62, you can get with your financial advisor, CPA, and kind of set up a path, and your agent, Medicare agent. But you can set up a path, and then that way you can maybe possibly reduce your income at retirement, so you don't get surprised and you're paying a really high Part B premium. Okay. So again, with a commercial plan, or an individual plan, you're either on a PPO or you're on an HMO. Okay. And a PPO generally has a little bit higher costs as you use it, but it gives you the freedom to go to most any doctor or hospital within their network, and so you've got a lot more freedom there. With an HMO, you're going to have lower costs, and you can still have some pretty high costs nowadays just with health insurance pricing. but generally you have lower deductibles and copays, and you've got a primary care physician who directs your care. So you have to get a pre-authorization or authorization or referral to get to a specialist or a different facility. And so with the HMO, you're going to be tied to a hospital, like a community hospital, so whoever you select. But that's the difference between the PPO and the HMO. So when you get to Medicare, your options are exactly the same. You've got option one, again, which is original Medicare with a supplemental in Part D. And the other option is an Advantage plan, which is an HMO. So let's take a look at the original Medicare. So how is that going to work? So when you get original Medicare plus a supplemental and Part D, you're going to go to the doctor, you're going to give them both your Medicare card as well as your supplemental card. And then that provider is going to go ahead and bill Medicare. Medicare is going to pay their portion and pay the provider. They're going to send an adjusted a bill over to the insurance company, who then will go ahead and pay that balance, less your $283 if that's the case for the year. But other than that, the insurance company is not involved in your business, which is kind of nice. So if Medicare pays, your insurance company pays. And here are some of the things that it covers, which we kind of already went through, but it covers your deductibles, your co-insurance, excess charges, skilled nursing, Part B, co-insurance and co-payments, and gives you an out-of-pocket limit as well. And then for option two, that's your Advantage or HMO plan. So like I said, it's a really good option for people here in Southern California and across the nation, but just here in Southern California, we've got such great hospitals and networks. It really works out well for people. And so if you like your HMO, you're going to love an Advantage plan. And with that Advantage plan, you're going to have no deductible and low copays. The only area you might find a deductible nowadays would be in the drug plan. But it's really going to be a low cost plan. And so you're going to have zero premium for most plans, and virtually no out-of-pocket costs other than like emergency and ambulance. And it just depends on the plan. But those are going to be your two costs, and they have very low out-of-pocket costs, like $500 or $1,000. But again, when you're not paying for anything other than a couple of copays like emergency or ambulance, it's going to be hard to get to that out-of-pocket maximum. So you would really love the plan, and it's going to add extra benefits as well. So it gives you dental, vision, gym membership, and other benefits. Okay, so those are your two options. Pretty simple, right? You've got option number one, which is original Medicare plus a supplemental Part D, which gives you just a dynamite plan to go anywhere you want in the nation. And then also the option two, which is a Medicare Advantage, which works like an HMO. Also excellent plan, very little out-of-pocket costs, and a lot of extra benefits. So when the difference between original Medicare, Part A and Part B is original Medicare, you can go to any doctor, any hospital that accepts Medicare across the nation, which is great. An HMO or an Advantage plan uses a network, and it's usually a community network. With prescriptions, original Medicare does not cover prescriptions, so you have to add a separate Part D plan, which we talked about. With a Medicare Advantage plan, Part D is included, prescription drug. Extra benefits, with original Medicare, you don't get any extra benefits. When you add a supplemental, you might get gym membership and discounts on dental and vision, something like that. But with original Medicare, you have no extra benefits. And then with the Medicare Advantage plan, you do. You've got dental, vision, gym, hearing, and so on. Your out-of-pocket maximum, you've got a lot of out-of-pocket costs, 20% co-insurance plus deductibles, and there is no maximum within the year that you would pay. So that's why you can buy a Medicare, a Medigap plan or Medicare supplement plan, and that fills in all the gaps. And just so you know, Medigap and the supplemental are exactly the same. They've just been called Medigap for a long time, but it's called a supplemental, and that pays all your deductibles and co-insurance. And then over here, your out-of-pocket costs, they vary by plan, but very low out-of-pocket maximum, and you'd have a hard time ever hitting it because just you have very little in the way of copays, and then you can't combine it with a Medigap plan. Okay. So prescription drug plans, it works, really similar to what you have now. So whether you have a PPO with the drug plan built into it, or an HMO which has a drug plan built into it, it works pretty much the same. You've got a small premium if you're buying it separate with a supplemental. If you're getting it through a Medicare Advantage plan, it's included. But generally, you're going to have a deductible on most of them. If you've got a lot of brand name medications, you might pick a plan that has a higher premium and a lower, lower deductible. It just depends on your medications, but it works just like the plan that you have now. So sometimes you do have a deductible for brand and non-formulary, and you have co-pays in each one of those areas, and you could have co-insurance. So a generic might be a zero copay, or a few dollars. A non-preferred generic might be a few more dollars, and then you get into brand and non-formulary, and then you could be paying 25% or something like that. And they do have an out-of-pocket maximum of $2,100. So even if you did have a really expensive drug that's covered by the plan, you would be stopped out. Okay. And so that earlier chart that I showed you for Part B, if you're making more than the baseline of 218 for a joint and 109 for a single filer, then you're going to pay an additional $1,450 to Social Security on top of your Part B premium. So you'd add $1,450 to that premium, and that you're going to pay every single month. Okay. So our services. So Medicare education is what we love to do. Love to educate and help and support others. And through our Medicare education, we've got a really good process here. We collect your provider and medications, and we check all those things. We have a 3-point system, which I'll go into in just a minute. But that way we can kind of review what your options are and your plans, and give you comparisons. We just make it really simple and very clear. And then your prescription drug plans are included in that. And then we do the annual review with you as well, and make sure that you're up to date and that you've made changes if you need to, and ongoing support year round. We continue to educate you, and we're here to support you every step of the way. Okay. So here's our process. It's a really simple process. We use a 3-step process. One is we get together about, like I said, 90 days out is good, 3 months. So we do what's called a discovery call. We do a 20-minute discovery call where we get the details on you, what plan you've been on, doctors, medications, any conditions, that sort of thing. Then we put together a personalized presentation where we do similar to what we're doing today. We go through the basics of Medicare, just kind of review that stuff with you. We go through your options based on what your needs are, and then we help you make that decision and enroll. And then the third step is that we do what's called an orientation meeting. And that's usually about 3 weeks later. We set up an orientation meeting, which again, it's an online meeting, and it takes about 30 minutes or so. And we go through and make sure you understand your plan, all your benefits, and how to access those benefits. And then we put together a really nice PDF that has the information on your plan, the links to all your different benefits and sites, phone numbers, and everything. We just try to make it just as simple as possible. Okay. So just kind of a summary of costs, so you kind of get an idea. And this is just, rough numbers, ballpark numbers. But if for Part B premium, it starts off at $202.90. So everyone's going to start the same place. If you make more money, it's going to be a little bit more than that. But whether you get a supplemental, go with original Medicare, a supplemental in Part D, or whether you go with an Advantage plan, you're both going to pay the $202.90. Okay. If you go with the supplemental and you add the Part D, you're going to add an extra $150 to $250 for the supplemental, and then maybe 0 to 200, which would be really expensive for a drug plan, but usually they're pretty inexpensive now. And so if you go with option number 1, you go with original Medicare plus adding a supplemental and Part D, it's going to run you about $350 to $400 a month. Okay, so that's kind of all in. And then if you go with an Advantage plan, an HMO, it's going to run you $202.90, and that's it, right? Because your plan premium, there is no plan premium for most plans. Your drugs are included, and so that would be your total premium cost. Now, the other out-of-pocket costs, you would have some out-of-pocket costs with the plans. The 283, which we talked about, co-pays for drugs, that sort of thing as you use it. But these are your premium costs. That's what you could expect on a monthly basis. Okay, so that's it. Just wanted to keep it really simple. I hope this was helpful. We would love to serve you and help you in any way. You can call our office at 310-414-9524, extension 2, which is here on the screen. You can email us. You can go, if you're an employer, agent, or CPA, you can go to RileyEBI.com, and you can get more information or set up a call with us. And if you're an individual, you can do the same. Our landing page is MedicareSouthBay.com, and you can go there and get some more information or schedule a call. So I'll go ahead and take a look to see if we have anything in chat. Okay. It doesn't look like we have any questions. So anyway, thank you for letting me serve and educate you. I hope this was helpful. Have a great day. All right, thanks.